Hello, everybody. Welcome back to the show, Science, Facts, and Fallacies podcast. My name is Cameron English. I'm your host as always. Joined again, as I always am, by Dr. Liza Dunn, toxicologist, emergency medicine physician. Excuse me, it's Friday, everyone. I want to tell you. What's up, Liza? How's it going?
Not much. Happy Friday.
Thank you. Thank you very much. I hope you all have a terrific Labor Day. I am going to barbecue and take my kids to the pool.
Ooh,
In
that'll be
honor
fun.
of all the laborers out there. Thank you
Hmm.
for laboring, whatever we're separate, labor unions, whatever. I'm going to have a hamburger in your honor.
There you go. Excellent.
We did have our most recent space today. I'm told it went very well. Twitter was giving me a hard time, so I had to jump off. But it was a great conversation. We had a really big audience again. We had lots of people contributing. We had to disabuse some people of the notion that our food supply contains poison, which might be the dumbest idea in the world. We have a safe food supply, and we're very grateful for that.
We are very grateful for that.
Okay, let's jump into our stories. I don't want to belabor it too long. We've got three as always. Really intriguing stuff. First up, AI is paving the path for dehumanizing medicine. Next up, Ozempic and sex, an unexpected benefit of GLP-1 weight loss drugs. And finally, dismissive of science and the real-world impact of their decisions, the Supreme Court has taken a troubling turn against evidence and expertise. No! We need evidence and expertise, everybody. Okay, first story here. This one is, I don't know, Liza, this just kind of tickles my spidey sense and it scares me a little bit. This is originally from Aeon. It's called Last Hours of an Organ Donor.
Hmm.
Is that what it's called? I don't know. I may have clicked on the wrong story. In any case,
No, I think it's no. That is it. It's actually a very, very moving
okay.
opening. Yeah.
Okay, I'm gonna leave it to Liza to break this down. But the gist of the story is that artificial intelligence is increasingly navigating its way into medicine, and there seems to be some tension. And Liza, you can of course speak to this personally. There seems to be some tension between allowing AI in to improve healthcare where it can, but then there's also some concern that you're edging out the physicians. And this could be troublesome. And again, you've talked about this on the show, that a big part of medicine is the art of it. It's you getting to know the patient and understanding their concerns and looking at their specific physical condition and understanding what they need. And a machine, however smart it is, however much it can learn, still can't do that. And so this opens up a lot of concerning possibilities, let's say. So maybe you can jump in. Maybe you want to start with that anecdote from the story and then give us your thoughts
So
as a doctor.
it was actually very moving. It was about an anesthesiologist who was taking care of a woman who had been in a car crash and she was brain dead. But they had kept her on life support so she could be an organ donor. And they talked about the emotions that the team had about doing this, because the anesthesiologist, for example, knows that there are reflex reactions to different kinds of incisions and things like that. So she was dead and technically couldn't feel anything, but when you cut open the chest, there were still reflex kind of reactions, right? And so what he was thinking was, well, maybe she's just on the liminal side, and I'm going to give her some pain medicine just in case. And so there's this whole kind of ritual that goes along with cases like this, and this realization that that although she's helping a whole bunch of other patients because she's going to be an organ donor, that there's a real need to respect what happened and give her honor, and that's all a part of the art of medicine. Even though she's not feeling things and things like that, there's just so much ritual that goes along with that story. So it was very moving to read that. And yes, when machines take over, so that it goes on to say that there's a possibility that you will have organ donors just being operated on by machines that are harvesting organs, and you lose that personal respect for the patient, and it may actually decrease the incidence of people being willing to donate organs, because if they feel like they're not being cared for, that it might result in a machine just sort of cutting them up, and in harvesting organs, and there's not that respect there or that spiritual kind of connectedness there, it may result in a decline in the amount of organ donors. And that's a problem because there are lots and lots of people, thousands of people on organ donation waiting lists. And so that's the gist of the article.
So I'm curious, maybe we're getting beyond the scope of the story right now, but are there areas of medicine that could be improved with the implementation of some of this AI technology? And then where do you think the line is? Like hard and fast, no, we're not going to let machines get involved in this aspect of medicine. What do you think?
Yeah, I think that people have been thinking that for a very long time, and it turns out that machines can help in some capacities, but other machines don't help at all, and actually make people want to leave medicine. And I think that they have tried to come up with protocols for how to treat different diseases based on a series of signs and symptoms. And you can list those things, but the part of the art of medicine is being able to take the list and build a differential diagnosis. And that has proven to be very difficult. And then decide what is most likely based on the signs and symptoms. So you'll get people, a computer program that people will go look up. I've got these signs and symptoms. What could it be? Right? And they will get a list of different things it could be based on their signs and symptoms. But it always ranges from, it could be the common cold, or you may be worried well, to you may have fatal cancer. So it doesn't usually help people. And they've been trying to come up with a way to replace physicians for a long time, or make it easier for computers to help. The claim for electronic medical records was that electronic medical records was going to make physicians' lives much easier, because you could read the handwriting. You wouldn't have errors with medication administration. You'd be able to share those records much more easily than having them in storage. And it turns out that the electronic medical record has turned into a vehicle for hospital billing and for selling patient data. So hospitals could sell patient data from the electronic medical record, even though the patient hasn't necessarily consented. So physicians are bound by HIPAA. So we are held very strictly about sharing patient data, and often even if you need the data to take care of a patient, you'll have a hard time getting it from somebody as a physician or a nurse, but the hospital can go sell it. So the result of the electronic medical record is that it collects all sorts of data that is completely irrelevant to patient care, and it has made life much more difficult for doctors. And they've tried to, they have these situations where if you're putting in an order for a drug, they'll have a pop-up drug-drug interaction. That seems on the surface that it might be good, but most drugs have some kind of interaction, and the degree of interaction is what matters, right? Is it going to make you bleed to death, or is it just, occasionally somebody gets an upset stomach? The machine can't tease that out. The machine just makes everything go there. Now, people will say that, certain surgical procedures have improved dramatically because of robotic surgery. And so machines have helped doctors do surgeries. But I don't know. I think that I don't think that I don't think AI is actually going to be able to replace the physician. You may be able to do it with radiology because it's images, right? But I'm not sure that they're going to be able to actually adequately replace bedside physician. And that said, bedside physicians are being replaced by nurse practitioners and mid-levels, and there are more and more doctors leaving, so they need to come up with some solution to that problem. But it's funny that the recommendations that doctors make don't get implemented. You have government agencies making all sorts of recommendations, and then hospitals implementing those, and then more and more doctors leave.
Final thought here, and tell me what you think. I could be pulling this out of the ether. It could just be total nonsense. But what I suspect might happen is you could get programs being integrated into medicine because of insurance companies, right? Just like
Right.
right, like you've complained about Epic quite a bit, and I could right. They buy up pharmacy benefit managers. They strike deals with pharmacies and with hospitals and with healthcare providers. And there's regulations that incentivize people to sort of be absorbed into the giant healthcare blob. So
Right.
the system is not entirely monopolized, but it's close. And I could see insurance companies, some bean counter going, well, we could save 32 cents on each interaction if this is done by a robot instead of a doctor, something like that.
Right.
And then patient care suffers because someone somewhere is going to,
Be a
get
bean
little
counter.
bit. Right. There's a little, like my stock will be worth a little bit more as a result of this. So I don't know, that concerns me. I just, the closer this gets to like really intimate interactions, whether it's health or personal relationships or your genetic data, I get much more nervous.
Me
as
too.
this comes closer. And everyone's always like, it's fine, stop being such a Luddite, it'll be great. And I'm like, I don't know, man.
I don't know, man. Yeah, I don't know,
Yeah.
man. I mean, every other government intervention into healthcare has turned into a fiasco. So we'll see what happens. Yeah.
People think in generalities, and they don't really like it when you say that. But it's a really, really interesting point from economics. That economists like Ludwig von Mises and Milton Friedman probably said it too. But it's a really important point, right? You intervene in the healthcare sector, and you cause some kind of distortion, which causes problems, and then the government goes, well, we need a law to fix that. And then you implement that law, and then you go, wow, there's another problem. And then you pass another law. And
before you know it,
here we are.
You've got doctors hightailing it out of the practice, and the patients not being able to get incredible expense because you've hired so many administrators to tell doctors what to do, to protect patients from doctors, apparently. And then, it's off the deep end. It's off the deep end. But if AI comes in there and you get something like the High Tech Act, which was passed by the Obama administration, requiring everybody to have electronic medical records, you lost all your independent practitioners, all your private practice doctors. That the cost prohibitiveness of getting to those systems was so profound that everybody went and worked at a hospital. And so now you've got doctors becoming hospital employees, and patients not being able to get appointments, even though we have the most expensive healthcare in the world.
Yeah, awesome stuff. It worked out really, really well. And it's working out really well in England, too. The NHS,
right.
Great shape. They have plenty of money. There's plenty of care to go around. I'm kidding. You can look that up on your own time. Okay. So it's an open question. There's probably some benefit, but it seems like there's a lot of risk, and that we're not really accounting for that very well just yet. Okay, second story here. This one is amusing, to say the least, Liza. So this is, and that's my young daughter coughing, by the way, everyone. If you hear cooing or coughing, it's because I have a 4-month-old in my arms right now. It's the joys of being a dad.
Yep.
You'll make it through. Okay, so this is from the Wall Street Journal by Sarah Ashley O'Brien. It's called Ozempic and Sex, the Unexpected Benefit of GLP-1 Weight Loss Drugs, ? Now, I love this story because it's an interesting way to introduce unintended side effects of drugs, and it's also amusing because it's about sex, and I'm still a teenage boy at heart, so I find it funny. The story opens, and you can talk about the neuroscience and so forth in here, but it starts off with this anecdote from this woman named Jacqueline, and the story says she and her husband had a great sex life, and then she started taking Ozempic, and you're thinking, uh-oh, what happened?
Yes.
And then it goes, we went from having sex a couple times a week to multiple times a day, to the point where her husband was like, I need a break, okay? And I was like, oh, the new relationship phase. But it's really interesting is that apparently in the clinical trials that were done and in the subsequent research, no one saw this as a side effect, good or bad. And now there are some studies starting to be done. And it appears that one of the benefits, and maybe this has to do with dopamine regulation or something, but they're saying, wow, this might be able to impact people's sexual health in a good way, their risk of, or their their alcoholism, their drug addiction. Maybe this is a way to moderate those unhealthy behaviors, just like it moderates their eating habits. And I'll let you dive into the specifics, but it's just fascinating because what we're watching, it's sort of a real world experiment as more people take this drug and we start to document these effects. And the good news, and this is another part of the story's framing, is that this seems to be beneficial. I mean, you have large groups of people losing 40
an incredible
to 80
amount
pounds
of weight. Yes.
and keeping it off, right? And what's interesting, because one of the concerns was people are going to stop taking this and they're going to gain all the weight back. And what seems to be happening is you have people, some people stop taking it, some people take it and then they stop for a little bit. And there's, in other words, it seems to be that there's ways to moderate the use of this drug.
Yes.
And still experience the benefits. So I'll stop there. Tell us a little bit more about it.
Yeah, I think it's really, really interesting. These drugs are turning out to be GLP-1 agonists, are turning out to really have not only just beneficial weight loss, because it helps with insulin release and it helps with satiety in the central nervous system, but they're having some really interesting side effects, quote unquote, when dealing with addictive kind of things. So people who are heavy drinkers have been decreasing the amount of alcohol that they have. They've sort of talked about how they aren't that interested in drinking as much anymore. Then obviously you decrease your overeating because you're not so hungry. And so it's had a profound impact on weight loss. And with they talk about liver disease and cardiovascular disease prevention and getting better with these things, and diabetes turning around with this thing. I think that that's probably just a function of the weight loss itself. So I think that with fatty liver, if you are decreasing your alcohol consumption, and if you're decreasing your actual burden of visceral fat because of this medicine, that helps with your liver health as well. With lots and lots of visceral fat, you wind up with insulin resistance. And so because you're insulin resistant, you're a little bit more sweet. You've got more sugar floating around in your blood. And so that predisposes you to type 2 diabetes. Losing that weight, we've known for decades before these drugs ever came, if you lost weight, that was beneficial in the setting of diabetes. This just helps reverse that kind of thing. And what also is interesting about gastric bypass, which is a surgical way of doing weight loss because your stomach's not so big, you actually get full, right? That really reversed diabetes in lots of people as well. So I suspect that it's not necessarily the drug that's reversing the diabetes by itself. I suspect that it's the loss of the fat itself that's done that. Now, the thing that I'm very interested in about the whole sex thing, it kind of reminds me of the Viagra story, right? So the Viagra story was that it was being they were using, they were running trials with Viagra to see if it was a good antihypertensive medicine, if it would lower blood pressure. And it actually does lower blood pressure. And some of the people in that trial were like, well, we've just noticed this little side effect. And so then they realized how much potential it had for erectile dysfunction. And so they switched and they said, oh, we're going to change this up. We're not so interested in using it as an antihypertensive. There's a much bigger demand for erectile dysfunction. But you got to be careful with that drug, because if you have somebody who's having a heart attack and you give them a nitroglycerin, they wind up having really, really, really low blood pressures. And sometimes they're embarrassed to tell you that they've been taking this medicine, right? So it makes for a complicated thing. So that's the Viagra story. But this could be kind of a similar thing. Just like, oh, wow, this is a good benefit. Now, I don't know if it's because you are rearranging the hormonal balance in your body. If you're losing fat, fat can produce a lot of estrogen. And so I wonder if losing that fat again can sort of rebalance things from a hormone perspective that makes you have an increased libido. You may just psychologically feel better about yourself because you're not so chunky, but you may also have a hormonal reason why. They are speculating whether or not this has an effect in the parts of your brain that have to do with addiction, right? And they suspect that they're making the speculation that that this somehow is modulating dopamine, which is the feel-good neurotransmitter, neurochemical in the parts of your brain that are responsible for addiction. Now, the thing that I'm not quite sure that I understand about that claim is it appears that they had that the modulation of the dopamine levels in the brain um, decrease addictive behavior for alcohol, right? So why would it increase addictive behavior for sex? So I'm not sure it's that part that's getting reset. I have to learn more about it. And once again, this is science in real time. We're learning more and more about this drug. It's a really cool drug, or a couple of different drugs. But I think it's fascinating. I think it's got potential to really help deal with our obesity epidemic. It's much less invasive than gastric bypass surgery and other surgeries we've been doing. And if this is a side benefit, yeah, they're gonna do well, these companies.
I'm gonna go put my my adorable daughter down, but while I do that, maybe you could talk about the possibility that it's just the weight loss that's responsible for this, because that is a side effect of obesity, is sexual dysfunction in some
Sexual
cases.
dysfunction. That's exactly right. And actually, sexual dysfunctions can be a sign of cardiovascular disease if you've got erectile dysfunction. And so it's a common kind of thing. So if you're overweight and you have diabetes and you wind up having often cardiovascular disease. And one of the signs of that can be erectile dysfunction. And because you are reversing the things that lead to cardiovascular disease, you can have improved sexual health in men and women. In rare cases, there was some discussion about whether or not this decreased people's libido. And there are people who have been writing on Reddit and other places that their libido has been decreased, but it seems to be offset by a number of people who say no, in fact, it's been increased. So it's a question: is it psychologically they're feeling better? They're feeling better about their appearance. They're feeling better about their body, and so they're more interested in that. Physiologically, are they less tired and do they have a less burden of a fat, which has endocrine properties, and is that getting back to steady state where that they increase their libido that way, or is it really happening in the central nervous system where you're stimulating your pleasure centers with dopamine? So it's hard to tease out at the moment what's what, but it's a really interesting phenomenon. I have a friend who's been on it for over a year. She's lost a tremendous amount of weight.
Yeah, the physician I co-host my other podcast with has been writing a series of stories, because he started taking it too at the suggestion of his wife, who's a nurse, and his cardiologist. So he's been documenting his experience, and it's just fascinating because he says, it's not like a magic pill. You don't take it and lose 20 pounds, but he says you take it and it moderates your blood sugar, like you were saying earlier. And then he says, now I'll be in a moment where typically if I was bored or stressed, I would go look for a snack. But in that moment, I go, oh, I don't need to do that. I'll be okay. And as a result of that, you start to form new habits.
Mm-hmm.
So there's all sorts of stuff going on physiologically. And I wonder if it's just a downstream effect of losing the weight and starting to develop a little more mindfulness,
mm-hmm.
and you start to feel better, like you said. And you're like, hey, what would be awesome to do tonight? Right?
Yeah.
And then, so
yeah, it'd be awesome to exercise.
Yes, yeah, little cardio never did anyone any harm. Oh, sex jokes are never not funny, everyone. That's just
they're hilarious.
Okay. We'll leave that there. Again, we've been coming back to Ozempic and all these other drugs. Fascinating topic. We're going to keep learning more, but I'm encouraged. Right? It's not like a drug where we're like, this is going to be great, and then all of a sudden people start keeling over from heart attacks. That hasn't happened so far, which is good.
Right.
Okay. Next story is going to be a tough one. I'm just going to give everyone a heads up. This is called dismissive of science and the real world impact of their decisions. The Supreme Court has taken a troubling turn against evidence and expertise. Now, this is a story by two of my colleagues at the American Council on Science and Health. They're both way more qualified than I am, so I hesitate to use that word. But we all write for the website, is what I'm saying. And the thing about it that I find a little concerning. Well, let me summarize the story first. So, there were two Supreme Court cases towards the beginning of summer that challenged what's known as the Chevron deference, and the basic idea, without getting into all the legalese, is that there was a court decision. It was Chevron Oil versus the Natural Resources Defense Council in the 1980s, and there was a dispute over the power of regulatory agencies, and the determination that came out of this court case was that courts are supposed to defer to agencies like the EPA and the FDA when it comes to questions about their authority of these regulatory agencies. And so for the last several decades, and it's been inconsistently applied, we'll get into that in a second, but this so-called Chevron deference has instructed courts to say when there's a scientific question or a question about the regulatory authority of a regulatory agency related to science or health or something, you're supposed to defer to that agency because they have the expertise. Now, this came up to the Supreme Court because there were two cases. It was two very small fishing businesses, like individual boats. They were tasked by the federal government to take a regulator from one of these agencies out on their fishing expeditions with them and pay them $700 a day to make sure that they are following all the rules, so on and so forth. Now, the issue up for dispute was the law that governs fishing in the U.S. It doesn't grant them that authority, at least not in that specific instance. So these two companies, they sued, and it made it all the way up to the Supreme Court, and the Supreme Court came down in late June, I think it was, and they said, we're done with the Chevron deference. And the world collectively broke out in hives, at least the science world. Like, everyone lost their marbles. They said, this is a repudiation of science and expertise, and we're all going to live in a frozen hellhole without electricity because we are telling the scientists that we don't care what they think, and we don't know what's going to happen. Right? Everyone lost their minds. And with due respect to Dr. Barbara Billauer, who's a great legal scholar I've mentioned before, and Dr. Henry Miller, who's a former FDA official, he's excellent when he talks about pesticides and agriculture and vaccines and so forth. So nothing I say is personal. Don't take that as an insult. I just mean that I think the argument here falls short for some reasons. We'll get into. But I'm curious, Liza. You're the physician. What do you think of this?
So I have very mixed feelings about that particular ruling, and I don't know that it's questioning the scientific expertise of people. I think what it was addressing actually is federal overreach in such situations. So if there is ambiguity in something, does a federal agency get to make a decision that it then imposes on communities and other groups that can be detrimental to those groups? So one of the examples that I was thinking about with this is the mandate that drinking water have zero PFAS in it, or the mandate that every single tiny speck of lead be cleaned up. That is going to, when you've got low levels of lead that's natural in the environment, that is not going to harm a child, or you've got low levels of PFAS, it's not going to harm the environment, and it's not going to harm your health at such low levels. And then you're making the community have to pay for huge cleanups of barely detectable levels to the tune of hundreds of millions, if not billions. And in some cases, I read an article where the levels that they're looking for will cost the United States $106 trillion to clean up. It's one thing if it's a huge concentration and contamination, right? But it's an entirely different thing if it's trace levels. If they're mandated to spend money in those areas, not only is it detrimental to communities that could be better spending that money doing, education or having, safety programs, or we've got a whole bunch of other things that they could be putting their money to. Once again, if it's a big, huge mess, then fine, clean it up. But if it's trace levels, and you can bankrupt communities to go after trace levels because of theoretical health issues that are not demonstrable, right? I think that's problematic. Like I understand, I get the idea of preemption, and I think that you need to have a balance where, if a federal agency has fully evaluated a chemistry and deems that it's okay to use it in these circumstances and with according to label or whatever, then it's much more difficult for companies if the states all decide that, or smaller jurisdictions decide to have a whole bunch of patchwork rules about whether, how, or where that pesticide can be used, or things like that chemical can be used. I get the argument that it's could lead to a complicated thing for companies to abide by, but I also get the idea that there's been a lot of federal overreach that really can have a negative impact on communities, and so I don't know what the best answer is in this case. I don't think the Supreme Court was trying to say that scientific expertise wasn't warranted. I think that the Supreme Court was trying to limit the imposition of undue costs on individuals and communities.
Yeah, not at all. They weren't interjecting and saying it's our job to interpret complicated science and make these sorts of judgments about whether a chemical is harmful or not. Just go read the decision. It's actually pretty readable. And I've been making a joke on Twitter in the last couple months of always reading the study when someone makes a claim. You see a headline, it's like, bees dying thanks to pesticides. I'm going to turn into a jingle, take it from your buddy, always read the study. Like, you just have to. You cannot trust, and this is, I think, is an exception because Henry and Barbara they're accurately describing a lot of the elements. I just think their conclusions are wrong. So, for example, and here is, this is from the decision, and all of the Supreme Court decisions, they're not paywalled like the studies you're forced to pay for. You can just go read them. They're online. And this is the majority decision. And the key point is that they're talking about whether or not federal agencies should be able to determine the extent of their own authority, which has zero to do with, how hot the atmosphere is getting, or, whether a pesticide is safe or not, or whether a vaccine should be given to children or not. These are not scientific or medical questions. The point they're making here is, and this is a direct quote, agencies have no special competence in resolving statutory ambiguities. Courts do, right? So if Congress passes a law that's related to fishing regulation and it's not clear on a particular issue, the court is saying it's our job as lawyers to figure out the best interpretation of the law because we are lawyers. That's what we do. And this is later down in the same paragraph, but this is the majority writing again. They say, it is no less true when the ambiguity that they're talking about resolving is about the scope of an agency's own power, perhaps the occasion on which abdication in favor of the agency is least appropriate, right? And I think that argument is very compelling because what everyone else is saying, and I honestly don't think most people read the decision who were complaining about it on the internet, right? They were just sort of echoing what a handful of popular science commentators were saying, that this is the end of the world as we know it, because the FDA is not going to be able to dictate every single thing that you do and say as it relates to your health. But that's the point. So anyone who comes to you and says, this is about judges being scientists, it is in no way about that. And if you just read the decision, it's very clear that they're not trying to do that. So I'll stop there. There's lots more to say. But Liza, what did you think?
Yeah, I think that the impact that it's going to be really interesting to see how this pans out. I think that it's not questioning the scientific expertise of EPA and FDA and things like that. I think that it's exactly what you said, and in fact, in a way, it might actually unburden the those agencies from a whole bunch of work that they now have time that they can now have time to focus on, real science. One of the things that you hear from a lot of people is that they feel like the agencies should be, really focused on, they feel like the agencies have companies have too much influence over the agencies, and the agencies should be doing this, that, the other, and they don't get things done on time, and they hand in, reams and reams and reams of information of what they deem to be important, and they expect those regulators to read those reams and reams and reams of comments and papers and stuff like that, and then also make a scientific decision based on reams and reams and reams of more information, right? So you are asking people to do an incredibly burdensome job, and then come to the right conclusion based on all of the inputs that they've gotten. And the more you ask of them, and the smaller the agency is, or the fewer people they have, the more responsibilities that people have, the less work they can get done. And you want them to get it done on timelines and things like that. So if you, I think it will, for them not having to go out and police all this kind of stuff, it may actually increase the amount of time they have to pay attention to science rather than, you know, regulatory policing.
Yes, that's a very good point. I would add something else, because their argument in this article is, these are the experts, they're objective, we need to trust them to make scientific decisions. And that's just wrong. That's wrong. And this is one of my problems with the article, is that they don't deal with the strongest counterexamples. They set up a reasonable case, but it excludes any information that would complicate their argument. So, for example, in 2016, the FDA granted itself authority to regulate electronic cigarettes, vaping devices. Okay? And there was a law passed in 2009 that gave FDA authority over tobacco, but not specifically e-cigarettes, because they weren't really on the market at the time. They were very new.
Mm-hmm.
So in 2016, FDA said, nicotine is derived from tobacco. We have authority over tobacco products. Ergo, we get to regulate these, right? And
Mm-hmm.
it was a big battle, but the rule came out. And then by 2020, the agency had received almost 7 million product applications, because they had to review every single device that any manufacturer put out, any nicotine liquid that's used in the devices that you vaporize. They had to review every single one. And I mean, it doesn't matter how many resources you have or how smart you are. 7 million applications is a lot. And subsequently, it's gone up to like 20. There's been 20 million applications that FDA has had to review. And they brought that on themselves.
Yeah.
They were pressured by Congress and by the anti-smoking groups to claim that authority for themselves,
Mm-hmm.
which they did, right? Interestingly, they're subject to political pressure too, right? Their expertise, their PhDs didn't wall them off from the politics.
Mm-hmm.
Okay, that's the first part. Second part is when companies started submitting these applications, they're called PMTAs if you want to look them up. I don't know why you would want to, but anyway, the FDA said you need to show us that the product is safe toxicologically, like there's not something harmful in the ingredient. The device isn't going to explode or something. And then you need to show us that you're helping more adults quit smoking than you're allowing children to take up nicotine,
Mm-hmm.
which is a reasonable standard. I totally get that.
Mm-hmm.
But they explicitly said you don't have to submit a clinical trial, which would take forever and cost millions of dollars. And you don't have to do a longitudinal study where you follow 20,000 people for 2 years.
Mm-hmm.
You just, and it's still not clear, right? The standards weren't communicated publicly, right? People that submitted the applications were told certain things. But when they got these 7 million applications in, all of a sudden the FDA, and this is, you can look this up, it's called the Fatal Flaw Memo. Just Google Fatal Flaw Memo FDA e-cigarette. They
Mm-hmm.
instituted a rule. The Food and Drug Administration, the experts, the overlords that look out for us and care for our well-being, They instituted a rule and they said, we are going to throw every single application in the paper shredder that does not include a clinical trial or a longitudinal study. So the vast majority, 99.9999% of applications weren't even reviewed. The FDA rejected them out of hand because they instituted a rule after the applications were submitted. So the only products that are legally available in the United States, there's still lots around that you can get, whatever, off, technically they're not allowed, but they're still there, are made by big tobacco companies, right? There's just a handful of products that are made by the cigarette manufacturers because they could survive that regulatory process. Mm-hmm. Now, they still didn't like it, mm-hmm. but they were able to survive. But every other small and mid-sized manufacturer was just decimated. You have small businesses all over the country that sell these products. They're out of business. And their customers, I want to remind everybody, are adults who are trying to quit smoking. There's right. 30 million Americans that still smoke who haven't been able to quit with patches or nicotine gum or whatever pharmaceutical drug. There's 500,000 people in the United States still dying from smoking. Mm-hmm. And the FDA, the benevolent overlords looking out for your health, threw all of these products effectively in the trash can. And the only reason that might be overturned is because, in part, the Chevron deference, and you have the manufacturers suing the FDA in federal court, and they're saying, you can't change the rules mid-game. And several federal courts have said, hey, we agree with that. Mm-hmm. And it's called a circuit split. You have multiple federal circuit courts that are disagreeing over that. And so it's quite likely that this will go up to the Supreme Court. So if Dr. Billauer and Dr. Miller get their way, the FDA would have the authority to just completely shut that down. And that to me is unacceptable. This is not about following the science. This is not about public health. This is, and our producer is going to have to edit me here, this is bullshit. This is just, you know what I mean? And the other thing that bugs me is that no one in science communication will talk about this because smokers are pariahs. It doesn't mm-hmm. matter what they do. We don't particularly care about them. If they want to quit, then they can use Nicorette or whatever. Mm-hmm. And then no one wants to talk about tobacco products because the tobacco industry, to some extent justifiably, is tainted mm-hmm. for making a product that kills people if you use it the way it's intended and lying about it for decades. Mm-hmm. So I get that. But that's a critical example. It's not the only one. There's other examples where you have EPA deliberately writing regulations that are unclear, so the courts will have to settle it. Mm. And they do that because they know that the environmental groups will sue the EPA on the grounds that the regulation is technically incorrect. You forgot to dot an I or cross a T, or it's not clear what you meant here. So they let the environmental groups sue in order that the regulations can be reoriented in a way that the NGOs like. And you know who I learned that from is Dr. Henry Miller. Oh. Okay? So you see what I'm getting at here. And I could go on 4 days. Yes. I'm not going to do that. But you see what I'm getting at?
But yes, I totally see what you're getting at. I think, though, that I don't want to in any way, shape, or form say that the regulatory agencies aren't needed. They are totally needed. They really, really provide a valuable service. They are full of real experts, and I think it's important to have that expertise to regulate products and to make sure that that the public is safe. So I think that there's got to be a balance, though. It can't be just a political point of view that is doing all the or influencing all the regulation. It needs to be science based, and it needs to and it shouldn't be too. It shouldn't be. There shouldn't be so many stringent rules that you actually can't get anything done. The scientists can't do their work, and it shouldn't be so loosey goosey that anybody can get something on the market. But there needs to be a Goldilocks kind of situation where you have a apolitical, very scientific agency that can make good recommendations that protect the public and also make sure that public have access to really great products. So I think that's the way it should be.
Totally. I don't like. No one's arguing. At least I don't think we are. No one's arguing for anarchy. Like,
Mm-mm.
do whatever you want and use whatever you want, and no one can tell you anything because freedom, right? No one's saying that, But you need the agencies to behave ethically,
Mm-hmm.
and you need them to be able to. And it's difficult for them to do because Congress controls their budget. So this is another potential problem, right? If a powerful senator from so and so state says, "You better do this," which by the way is illegal in its own right. You better do this or I'm going to hold up your budget or I'm going to fire you. I'm going to replace you, you
Mm-hmm.
know. And they cave to that, well then they're not serving their purpose, right? The whole point of these executive agencies is that they are the experts and they're going to give us the science but that's not happening in many cases. That's all I'm saying, right? So yes, there's lots of very good scientists at EPA. When they say something, when they put out, I don't know, an 800-page report on a weed killer or something,
Mm-hmm.
that they went through it and they went through all the data, right? They're very capable of doing good work when they want to. But that's not what we're talking about here. What we're talking about here is, who gets to decide how much authority they have. And what the other side of the argument is telling you is, well, they do because they're so smart. And that's clearly not working, right? There are real consequences and it's harming people's health. The one final thing that I have to rant about before we jump off is that in this article, they talk about the fact that the Supreme Court during the pandemic ruled against a couple states, New York and as well as California, where I'm at, and they said that your COVID restrictions are too draconian. And in particular, they said you're not allowed to limit church services to 10 people. And again, Team Science was like, oh, how dare you tell the scientists they can't close churches? And again, here's my problem here is hypocrisy, right? Because while this was going on, while we were having these debates about who can go to church and who can go to lunch and who can do this and who can do that, there were rallies of hundreds of thousands of people in major cities across the country. Some have got very violent and resulted in the destruction of property.
That's right.
Nobody had the spine to stand up, not Tony Fauci, not Deborah Birx, not the CDC, not the FDA. No one who has an opinion on this case stood up and said, you cannot by the hundreds of thousands gather in major cities in the middle of a pandemic. And as I've said before, NPR ran this ridiculous story where they had 50 public health experts who said, and the direct quote, I couldn't believe when I read it was, these experts say, congregating was the word, congregating in the middle of a global pandemic should be fine because we need to fight racism because racism is a critical public health threat. So all I'm saying is when you give people the authority to stand up for science, they won't do it if it threatens them.
That's right.
That's the trend that we're seeing. And that's what bugs me is that we don't live in a technocracy. It's coming closer, but that's not what the United States is supposed to be. This is supposed to be a relatively free country with individual states largely governing themselves. So I didn't, you know what I mean? Like we were born into this, but the country was not established. So people in white coats could dictate everything that we do. I don't want that, right? And there was no, and again, we're going to have all these people congregating in the streets. There was no studies done that said people gathering in churches are killing people by the tens of thousands.
Yep.
There were no good studies done, and understandably, that the lockdowns were justifiable, right?
I think that was a defining moment in the COVID pandemic, and I think it was disastrous for medicine and public health.
It was. I get really worked up about this because I don't know. Like my wife's a public school teacher. I saw her students suffer because of these idiotic rules, and I saw how it affected her being stuck in our house, not being able to, like kids with disabilities who she normally works with in person were just totally blown off, right? Mm-hmm. Because there's a teachers union somewhere that has the CDC's ear. Mm-hmm. That's not science. And people pick and choose, right? I'm for the science, but sometimes, right? I get to pick what counts as the science.
Yeah.
And anyways, I don't know. You want to know why
I
RFK
agree.
is where he is? That's why. That's why he had a viable presidential campaign. That's why he's now pushing the Trump campaign. He was a major figure before, but he is like a major political force now because of this. Because of this.
That's exactly right.
Anyways, all that to say, the Chevron deference deserves to burn forever. It's hot garbage. It's invasive. It allowed the federal government to interpose itself in your life in all sorts of ridiculous ways, right? If you want to own a fishing boat, well, you got to pay this clown $700 so he can count the number of fish. No thanks. I'm all set. Okay. All right. Anyways. We'll wrap it up there. I'm sorry. I get on these rants.
No, it's great.
Get on my soapbox. And I'm like, bah, bah. I must sound like a villager with a pitchfork and a torch or something.
No, you don't. Not at all.
Okay. We're done. Thank you for indulging me, everyone. Join us next week. We'll be back with a fresh set of stories. Come to our spaces every Friday at 11 a.m. Central Time. You're welcome to speak. You're welcome to ask questions. You're welcome to shout at me. I won't get offended. You can disagree with me. Yeah. I mean, it's probably better. You will come off more convincing if you're nicer to people.
That's true. And if you really do call people names, you will be taken off the space because we don't like Jerry Springer spaces.
Yeah, it's not like that. For example, we had a grown man try to shush another grown man on our last space. So we had to intervene and say, everyone stop talking or we're going to mute the space. We will turn this space around. Right?
So yes.
Just be respectful, and then we'll have a great time. So we'll see you there at Dr. Liza MD on Twitter, at CamJ English on Twitter, on X, whatever it's called. Thank you so much. We'll see you next time.
See you next time.